Good morning. Today we're going to be talking about head and neck cancers because April is the month for head and neck cancer awareness. Thank you, Dr. Ogungbo, for joining us once again on Doctors on Air. It's always a pleasure to have you here. Today we're going to be talking about head and neck cancers. The theme, or they don't actually have a specific theme, but the focus is on new research, new treatment, and what's available. But head and neck cancers in Nigeria, can you tell us a bit about it? What is it? How common is it? And what is really being done about it here?
That's a very good one. And thanks for having me on your program. It's a pleasure to be here as always. Let me start by saying essentially that head and neck cancers or head and neck tumors are those tumors that are in the face. They are inside the head and inside our face. So anything inside the mouth, the tongue, the salivary glands, inside the nasal cavity, those are the areas where these kind of tumors occur. And because of where they are, it makes them, critically important. And in a way, they are hidden away. And most times people don't know about them until they are sizable or, really causing problems. As far as what a big problem it is in Nigeria, I don't have statistics, to be able to talk confidently on that. Because of course we don't do statistics, in Nigeria. For good statistical or collection of such data, you need government or some institutional backing, and serious funding to collect such data nationally. So we don't have good data, but I know that my friends, dentists, ENT surgeons, maxillofacial surgeons are those who are, involved with managing those cancers. And it's really their purview, to collect such data, but oftentimes they collect in their own local centers or according to their own particular personal experiences.
So, but would you say it's common or would you say it's not common?
Oh, from speaking to maxillofacial surgeons, and I know definitely one of those that's in Abuja who does outreaches, it is very common. I mean, when they go to do free treatment, free surgeries, there just seems to be loads and loads of people coming out of the nooks and crannies, people who have been living with their tumors or their cancers and similarly not able to find access to healthcare. So it is common out there. It's just, people can't afford it and access is blocked, for many.
So what do you think we should do about it? I mean, at the end of the day, we're talking about these head and neck cancers. We're talking about awareness. We're talking about raising that, that bar. So or opening the, drawing back the curtain so that people can know about these cancers. People can seek help for the cancers. We have a lot of cancers, for example, that are caused by so many different things. I mean, the problem with obviously talking about head and neck cancers is that there's so many types. Yeah. Maybe we should stick to the commonest 1 or 2 or 3 and just start with that and then talk about symptoms, signs, etc. So what is the commonest form of head and neck cancer, you would say? Is it in the mouth? Is it in the throat? Which one is the most?
It's in the mouth, it's in the throat, it's in the salivary glands, it's on the tongue. It's inside the air sinuses inside the face. And the thing is that sometimes it might just be that somebody feels that there's a lump on their tongue. And so they have to go to, to see somebody about that. And then you find that they have what we call them squamous cell carcinomas, because these are from the squamous cell, which is the one that lines the mouth and the nasal cavities. So rarely people may find a lump under their chin, which might be because the cancer or the tumor has spread to some of the lymph nodes, which, help us to fight, infection in the body. And, those are the ways that people develop or, discover that
what other kinds of symptoms would they present with?
Well, they can find that there's a lump on their throat. They can find that when they're brushing that there's bleeding. And so they might find that there's, eventually cancer in the gums. Bleeding from the nose as well. or like I said, sore throat, hoarseness of the voice, and then lumps and bumps, under the chin or behind the ears, which may then, with investigation, lead to, some experts or specialists discovering that they actually do have cancer.
Do they ever present with difficulty swallowing?
It definitely can present with difficulty swallowing, because this kind of cancers can affect the voice box or close to the voice box. And so it can lead to hoarseness of the voice or difficulty in swallowing. Definitely any tumors inside the mouth can, give you a change in the voice pattern, or definitely difficulty in swallowing.
Okay, so if we are looking at difficulty swallowing, which is a common symptom, really, I mean, difficulty swallowing can happen for any reason.
Yeah.
Any sore throats can give you a difficulty swallowing. When should people, seek help? How will people, I mean, right now we're just talking about the oral cancers. When should they seek help? How long after they've had a difficulty in swallowing? You can't just, I have difficulty in swallowing today and then rush and think I have a cancer tomorrow. So when should we seek help?
Well, I don't think it's to rush to, make an assumption that somebody has cancer. That, for most patients, it's far-fetched. And it's, not the initial diagnosis, of course. It could be simple sore throats, cold and cough, that's, leading to, difficulty in swallowing or hoarseness of the voice. But if this is persistent, if this is going on for weeks and months, then definitely somebody should ask for assistance, and not something you should joke with. But also, if anyone is coughing up blood, or there's having blood in their saliva, or they're having this, not, well, let me not call it discharges, but a foul smelling saliva, that they're just, it's not them, they're not, it's not something, it's something that is strange, or bits of tissue that they're coughing up or spitting out, then definitely they need to, have somebody look at them to ensure that all is well. So it's often, we're far from making a diagnosis of cancer, not just from what the patient's symptoms are, but it has to be that a specialist has, had a proper look, examined them, and maybe even, did a biopsy, taking a little bit of any abnormal area, to have a look at, to be able to confirm that, yes, they may have, a tumor, or sadly, cancer.
Now, that can be sad. And, I know that there are different kinds of tumors in the head and neck. Can you tell us a bit about the different types that they have? And, are there any specific risk factors that make a person, more predisposed to getting a cancer there?
This
Things
is
that people
great.
can avoid.
Yeah, this is great. I think the major risk factors are things like smoking, and tobacco use, or people who chew tobacco and other kind of things that people chew. But definitely also there are some kind of professions that exposes you to the risk of cancer, especially if you're there breathing in smoke all the time, or you're in those industries where there's a lot of dirt in the air that you're breathing in. People who work with asbestos, for example, or people who work with ceramic, those types of professions where all these little particles can go into the air cavities, into the mouth, into the nose, and definitely can lead to irritation, and then chronic irritation like that can lead to cancer. So definitely, big one is tobacco. Another big one is smoking, cigarette smoking. They are major risks for developing those kind of cancers.
Now, in terms of other issues, it's been said that viruses cause a huge, a huge risk factor as well.
Yeah.
Things like Epstein-Barr, things like HPV, and so on.
Human papilloma virus. Yeah.
Yeah. So, how, is there any way that people can avoid these, or are there any steps that they can take that will sort of mitigate their risk, shall I say, of some of these infections that can possibly lead
As I suppose
cancers.
the key one is human papillomavirus, which can be detected by tests, and there are also vaccines against particular viruses that can help. But I'm not aware where there is any link of human papillomavirus with some people with cervical cancer who can then have oral cancer. But HPV is more associated with cervical cancer, and that may be because of sexual exposure and sexual activity. But for oral cancers, yes, HPV has been implicated, Epstein-Barr has been implicated, but we don't have any particular professional association in that regard that one can blame. And I don't think that there are any tests specifically that ordinary people can do to identify whether they are at higher risk of developing those cancers. I think the ones we should be happening on really is people who chew or smoke tobacco.
Now, that's great to know about those facts and those features. But one of the questions that a lot of people ask is, can head and neck cancer be hereditary?
Oh, that's a good one. They can be. There are definitely some hereditary diseases or some diseases that runs in families, which can then predispose family members to a particular or this type of cancers. Definitely, there's some genetic linkage with head and neck tumors.
Now, apart from the oral ones, quickly, would you say the ones of the eyes would be next, or what would which ones would be like the second commonest, so that we can just give a quick discussion on that before we go into sort of more details?
I think the thing is to when we're focusing on head and neck cancer specifically, most of them are tumors that are inside the face, which is the way I'd like to describe it, that this tumor is inside the face. So all the tissues inside the face, the salivary glands, the tongue, the mucosal around the teeth, the vocal cords, going up into the nasal cavity, into the nose. Those are all the areas that are connected to each other where this, type of tumors occur. The eye, the neck itself, like, going outside of the face into the neck, into the thyroid gland, into all those tissues in the neck, they're not often classified in the same way as a head and neck or head and neck cancers. They're not really out. So cancers inside the eye itself specifically is not classified, as part of this, kind of cancers.
Yeah, because I think it's not very clear, because anybody looking at somebody's head would see the eyes, would see so many other parts to it. And that's why it's just so important to talk about these things, to clarify these things, so people know who and what it is they do. So if, for example, a person is worried about head and neck cancer, are there any kinds of screenings they can do?
But they should ideally go, if we were the type of country where we have general practitioners, they should take their concern to a general practitioner and just get the general practitioner to, if necessary, refer on to a specialist. This kind of tumors or cancers are specialist diagnosis. They need to be seen by a specialist. It's not something for the general practitioner to be blasé about and think, oh, I know what that is. No, they need to be referred to specialists. So if it requires that a dentist or an ENT surgeon or a maxillofacial surgeon see the patient, then that's the major job of the general practitioner on a patient coming to complain about any lump or bump or sore in the mouth or long standing sore throat or difficulty in swallowing. Those with demand that the general practitioner refer them to the specific specialist. And the specialists have an array of equipment that they can use in looking into the mouth. We have lots of, different types of lights, magnification lenses, endoscopes. There's so many different things that, specialists have at their disposal to be able to identify what's going on and help tease out, this is something that will go away, nothing to worry about, but this is something that needs special attention because it might be cancer.
Thank you, madam, for coming to share your experience with us. Can you tell us what happened? How old you were when you first started having symptoms, and what were those symptoms when the condition first started?
Then I was 21. It was my first year in Oyo State College of Education. It was first semester, so I started feeling this pain in my ear. I went to doctor, they said there's nothing there. I went to doctor for almost like a year or more than a year. I was getting thinner every day until my face started fading, and some parts I was feeling some kind of that one eye cannot see again, some were even closing, and my ear was swollen. I even went back to the doctor that my eyes is closing. What's happening? He said that there's nothing in my ear.
Was there any lump anywhere? Any lump? Did you see any lump or any swelling?
It was my ear later. So now it started swelling up. I went back to him again, said that there's nothing there. Until my dad now later followed me and my pastor. He now went to him that, what is he telling me that there's nothing, and this pain is too much that I cannot do every hour. I have to use paracetamol or any pain relief to relieve myself. Every hour I have to use paracetamol. Then I went to take 1 carton of this drug, Pamela, is a pain relief drug, that I have to use it. If I have to go anywhere with water and my drugs to take it. Now, that day, my pastor, my dad, and my evangelist now went to him that he should give me something. Now wrote a lot of tests for us that we should go and do is that anything that comes out. So, because after everything, now went to him back. And I said that there's something at the back of my nose, so that I have to go to Ibadan to go and do surgery. I went to Ibadan. I did the surgery. It was after. They didn't ask us to come back after 40 days. That 40 days, they started COVID. Like, they now asked us that we cannot come back, that we should go back to that they have to send everybody to hospital house. I was crying out, why God? Is it only me? Is it that God did not want to heal me today now? My sister said I should just calm down. Then they gave her the results of the test we did. Like, they removed something from my nose to know if it was cancer or growth. So they gave her the result, but she did not tell me anything. I just heard my sister and my dad crying inside the car. I said, they just said, let's go, no worry. I said, okay, no problem. The day we got home, my dad had to go to loot to make a inquiry that how can we come here or something like that. He came back home, he said they said I should come tomorrow. I cannot walk. Because my sister's husband, I used to carry my sister and wheelchair. Because even if I'm going upstairs, my dad has to carry me like a baby. Then I was skeleton itself is fatter than me then. I did not have anybody like this. People were saying, like, everybody that comes inside and see me, they always cry. Like, God, is this me? I'm a skeleton. Then I'm always crying that if it's death, that God should even take me instead of people seeing me and cry over me. I don't like it. And that's the next thing I should try to be singing. He gave me one phone. I should play song and I should be singing inside anytime I'm alone. If people knock, I cannot stand up. So I only ask, who is there? Nobody is at home. Maybe you should come back home. I can talk, but I cannot see and I cannot walk there. When I now got to know, the doctor said we have to do chemotherapy. I will take 4 cases of chemo. I took the first one. It was not even easy. The chemo itself was not easy. Because after the chemo, I have to vomit. I have to throw up for almost a week. So after 3 weeks again, I went back for another one. After the third one, the doctor now said it's not all. No, we have to take radio again. And I'll be coming every day. I said, God. Then they did not have like bed in this way that they cannot even admit me. Why will I be coming every day? The transport fare, the money set for the radio. I started begging people that they should. My dad even said I should do video because there's no money again. The money we have spent for almost like 2 years. No money again. He said, okay, let's do video so that people will post. I know my dad, I don't want social media. He said, okay, we'll not put it on social media. That maybe only WhatsApp. Okay, everybody started posting me that we need money. And 790 or 800,000. But to God be the grace that even then there was no money. Everybody was this. I don't know how God did it. We got the money. It was not even up to 4 days. We got the money. I went back to hospital. And they should start the treatment. And I started going. Even last month that I went back to hospital, they said to do CT scan. And they said there's nothing there. That the CT scan said is even better. And I said, I told you, and there's nothing there. I just want to go and discover. I said, it's good that I even go, and they told me that there's nothing again.
That's beautiful. But after the radiotherapy, how did you feel? How did you start getting better?
After the radiotherapy, I was okay, but all my neck was black. Like I was not very black. I think it was the machine. All my hair was, my back hair, it was all gone. But later I started to be using one cream for my face and my neck. But then I was very fat, like people did not even recognize me. My voice changed, everything. If I tell people I'm the one, Esther, they will say, no, it's not me. What did I eat like this? No. Like people never recognize me because I was not fat before, even when I was not sick. One time like that, I just started, like I was very big, but later I now came down.
So you put on weight and you started feeling
Yes.
better. And
Yes,
your recent CT scan showed nothing there. I think to God be the glory. I don't know if you want to say any words to thank God for deliverance and to thank God for the hospital and for the treatment that you've had.
Like I don't even know where to start thanking God from. I like me say more. I don't know where, like God is so wonderful, like he's awesome. I start thanking God, I might start crying, like to God be the grace. That's all I can say. And I should always remember God, that if not for God, where can I be today? If not for God, I know where my mates are. They're in the mortuary, they're in the cemetery, but God is the one to be praised. And for the doctors, my doctor, most especially my doctor, Dr. Godwin, I like him. Like he makes me laugh anytime I go there. I like and I appreciate him very well. I love himself. I cannot say I like him.
Okay. Well,
And
God for that.
they are nice people. They are friends. They love me. Like anytime I come beside that, my name is always in their head. But then Esther, also today, now you are fire. You are doing shakara for us. And my Alaja in the therapy center. I love them, everyone. Even the cleaners, everybody there, they are nice.
That's great. So what do you want to say? Because sometimes some people, they say, chemotherapy is hard, they don't want to do it. Or radiotherapy is hard, they don't want to do it. Can you encourage them?
Like chemotherapy is hard though. If they say it's hard, because if you get in you cannot eat you. No, it was the radio that I could not even eat. I could not eat pepper and I could not know any taste again. That's what the radiotherapy. But later, I'm fine. I cannot advise them not to take chemo because that is the only treatment they can do. It's hard though, but it's still the best treatment ever. It's so they should not lose hope. They should just keep praying that God give me the strength to take this the treatment. I'll be fine. That's all.
Okay. Thank you very much for sharing with us.
You're
I know
welcome.
that you've had so many different emotions through this period, but now we pray that your joy will continue to last.
Amen.
Amen. Okay. Thank you so much.
Thank you for watching. Please like, share and subscribe for new video updates.